they were coming to me and saying, hey, you know, my motivation really sucks. My concentration's terrible. I sit in meetings. I can't focus for a second. My mood's all over the place. I'm short with my kids, grumpy at work, hard to get along with, get super emotional for no reason. Sex drive sucks. My body composition's shifting, like losing muscle, I'm gaining fat, but I'm working with a nutrition. I'm working with a strength and conditioning coach. At that point in my career, I didn't know anything about sleep. I didn't have a single class on sleep in medical school, nor did any other doctor that I know of. Maybe now, but not by the time I went through training. I think I probably found out how they slept by asking about the meds they were on. You know, it took me kind of a while to catch on to it. This little trend that seemed like everybody who came in my office complaining about all these symptoms, which I was calling the SEAL syndrome, since been studied and more detailed by, you know, PhDs, and now it's called the operator syndrome.
Welcome to After Hours with Dr. Sigaloff, where he can share ideas and thoughts with you. He gets to the heart of the issue so that you can find the truth. The views and opinions expressed are his and do not represent the U.S. Army, DoD, nor the U.S. government. Dr. Sigaloff was either off duty or on approved leave, and Dr. Sigaloff was not in uniform at the time of recording. Now, to Dr. Sigaloff.
All right, well, thank you for joining me again. Today we have a very special guest, and I'll introduce him in just a moment. But I want to thank all of our Patreon supporters. We have Shell Pace at the $50 level, Sam and Angela Shelkey at the $20.20. We have the Plandemic Reprimando, which is $17.76 a month with Ty, Charles, Tinfoil, Stanley, Dr. Anna, Frank, the $10 level with Kevin Alanos. We have the Refined Not Burned $5 giving level with Linda, Emmy, Joe, Pat and Bev, PJ, Rebecca, Marcus, Elizabeth, Dawn, Jennifer. And then the lowest level where the courage is contagious, we have Amanda, Jay, Spetsnasty, Darrell, and Susan. I want to thank everyone so much for contributing. It does mean the world to me. Now, this next guest I have, he is a doctor who's gone through his own difficulty while being active duty. He first started off as a Navy SEAL, and he completed SEAL training at 19 years of age. And then he went into the Gulf War as a Navy SEAL. And then in 1994, he left the military to go get a college education. He re-entered the military, the Navy in particular, to attend medical school at Bethesda, where he was commissioned as an officer in the Navy in 2000. He began to practice medicine for the Navy SEALs. And this is where he learned there's a difference between health care and health. And this is kind of the difference between an MD and a DO, I would suppose, is that our goal as physicians is to look for health, not just provide health care. He had his difficulties treating the special operators with the medicine they needed to get them at peak performance. Dr. Parsley has worked with thousands of elite performers and has had tremendous success optimizing physical, cognitive, and emotional performance. And he builds this on what we've talked about before at this podcast: sleep, nutrition, exercise, stress mitigation, and with a strong emphasis on sleep. Well, Dr. Parsley, thank you so much for joining me today. As I understand, you were having some difficulty when you were active duty because you were doing things that were more DO-centric, and I think we had some glitches here and there, and I don't know if we recorded it yet, but I kind of found out that you trained under a DO before you even started med school, and that kind of helped shape your philosophy, it seems.
Yeah, for sure. And also, you know, I guess I was about 25 when I started college and started working with all those guys. And so, you know, my only exposure to doctors had been in the military, like, you know, for Navy physicals, whatever, or for orthopedic injuries. So I really thought of medicine was as like a way to help people perform better. And that's kind of the way that I always thought about it. I didn't really realize that it was so heavily focused on disease care, and not even disease care. That's a stretch. You know, yeah, I don't know what else to call it, but you know, identifying disease and following protocols, you know, something like that, which never really entered my mind as the way things would be. But yeah, you know, when I got to the SEAL teams, you know, these are by and large, by society terms, young people, whether they consider themselves young or not, like, a 32, 34-year-old SEAL considers himself old. Not unlike a fighter or a bull rider or something like that. It's just a rough, hard job that's better suited for young rubber people. But when I got there, the guys, the first thing to note is that they're a lot like professional athletes in that they don't. The worst thing that you can do for them is take them out of their job. So putting them on the bench even for 6 weeks or 8 weeks is about the worst fate they can imagine. So they usually don't tell their doctors anything. And the advantage I had, of course, is that I'd been a SEAL, and not only was I a SEAL, but I'd gone through training and done deployments with SEALs that were still at the command, so people knew me. I obviously had at least a decent reputation, and people trusted me enough to come and talk to me. You never really know what your reputation is, but I feel like I had a pretty good reputation, so people came and talked to me, and they were telling me things that weren't diseases, right? They were coming to me and saying, hey, my motivation really sucks. My concentration's terrible. I sit in meetings. I can't focus for a second. My mood's all over the place. I'm short with my kids. I'm grumpy at work. I'm hard to get along with. I get super emotional for no reason. My sex drive sucks. My body composition's shifting. Like, I'm losing muscle. I'm gaining fat, but I'm working with a nutritionist. I'm working with a strength and conditioning coach. And at that point, in my career, I didn't know anything about sleep. I didn't have a single class on sleep in medical school, nor did any other doctor that I know of. Maybe now, but not by the time I went through training. And I don't even really remember if I asked them about sleep. I think I probably found out how they slept by asking about the meds they were on. And, it took me kind of a while to catch on to it, but I caught on to this little trend that it seemed like everybody who came in my office complaining about all these symptoms, which I was calling the SEAL syndrome. It's since been studied and more detailed by PhDs and written up into peer-reviewed journals, and now it's called the operator syndrome. But it's all the same findings, and so of course, I didn't have any idea. I when they first started talking to me, I was thinking, well, in previous war we had these things called shell shock, and we had combat fatigue, and although these weren't really well described things, this was 2009, so we'd been at war for 8 years, and I thought, well, maybe this is that. And so I kind of started trying to look back towards that, but nothing reached the level of disease, right? So it wasn't like I could just say, oh, well, that's this, and so here's the protocol I follow. And because I didn't know, and I was completely honest with them and saying, I don't know, like, I have no idea what's causing this, but you're not the first guy to tell me this. And in fact, their stories were so similar. After the first 10 guys came in my office, the next 300 guys who came in, I could have told them their stories and saved time. But of course I didn't. I always went through and looked for unique things. And so originally I started thinking, well, maybe it's, maybe it's this thing, this combat fatigue or shell shock or something, and look back and see what were the treatments. Well, nobody really knew then either. Nobody knew how to treat it then. But I started looking sort of towards non-traditional alternative methods and thinking, well, maybe there's, some sort of toxicity involved. I don't know what's, what could I possibly look at? So I really just kind of came up with a lab panel that was anything I could possibly imagine might be affecting their performance. And I had them run to the hospital, and it was, 98 different serum markers, 17 vials of blood. The military wasn't a big fan of that. Apparently, that was costing about $2,000 per person. So I got in a little trouble for that. Um, but what came back was, by and large, it was, it wouldn't have, had I sent it to an endocrinologist or pain specialist, by and large, it wouldn't have reached their threshold for disease, right? But their testosterone, their bioavailable free testosterone, any mark you want to look at there, that was all probably in the lowest 10% of the normal range, right? And the normal range, of course, is enormous, from 250 to 1100. And we can go through the data, like the normal range and the BS there, how they came up with that. But basically everything anabolic, every kind of anabolic marker you can think of, those were all really low. And sometimes they were clinically low, but most of the times I'd say they're in the lowest 10 to 20% of the range. Everything catabolic or inflammatory looked really high. Their insulin sensitivity is what really threw me off, because a lot of these guys I knew really well, and I knew that they were, I knew how they ate, and I knew how they worked out. I knew how they lived their lives, and they were doing everything right. And again, they weren't diabetic, they weren't pre-diabetic, but it was much higher than their HbA1c, their fasting insulin, their fasting blood glucose, a lot higher than you would expect for someone as fit as they were. So, like I said, somewhere in the first 30, 40 guys, I don't know, a kind of a bell went off on my brain. I remember really clearly where I was when I was sitting there, taking down his history, and I was asking him about his meds, and he said one of the things he was taking was Ambien. And I thought, well, wow, it seems like a lot of guys say that. And so I made a note in the margin, and then I came back later and looked at it, looked through all of my patient files, because another thing that they trusted me to do was not put any of this in their medical record if it was could be damaging to their career. So I kept shadow files, and when I left, I just gave them all those shadow files and said, "This is supposed to go in your medical record. Do with it, as you please." Like I'm not the moral arbiter here. And so, I went back through all their shadow files and found out pretty much every single guy who had been in my office. Well, it was 100% of the people who had come in my office to tell me the story were taking Ambien. So I thought, wow, maybe there's something there. Like I don't know. Like it wasn't obvious to me that there was something there, but it just seemed like a hell of a coincidence. And the pharmaceutical game, the FDA owns the research, or I'm sorry, the pharmaceutical industry owns the research that they give the FDA. They cherry pick, they give the FDA what they want. They don't have to give the FDA everything. They just give them the most salient data. But then if they ever get sued, then they have to cough up all the research, right? And so they had been sued. Actually, that year, it was either late 2008 or early 2009, they had gotten sued for dissociative properties of Ambien, which was basically, people were taking Ambien, their neocortex was completely dissociating from their midbrain and brainstem, and they were just going out and doing animalistic behaviors, picking out prostitutes, gambling, gorging themselves on food, and they were so dissociated, they would go out for 4 hours, 6 hours, come home, get back in bed, wake up a couple hours later and not remember anything. But maybe, if they lived in Vegas, they might have gone down, to the casino and gambled away their life savings, or, picked up a prostitute, got arrested for it. No recollection of it. So anyways, they were sued. When they were sued, they had to cough up all the data. Again, I didn't know enough about sleep to understand the data, but I started educating myself on, well, what happens when you sleep? Like maybe this could be affecting some of their performance. And so, no big surprise. I would say the average citizen now who engages in social media whatsoever knows 100 times more about sleep than I knew at that time. Nobody was talking about sleep. That just wasn't a topic that the culture was talking about. And so, once I learned about sleep and started learning about what happens during the sleep stages, I realized, well, every single symptom these guys are complaining about could be caused by lack of sleep. I didn't honestly think it would explain everything, but I thought, this is probably a big mover. Like a simple example, 95, 98% of all the testosterone you make in a 24-hour period, you make during the first 4 hours of sleep, right? Because you're making it during your, deep sleep, like what we call slow wave sleep cycles or deep sleep or stages 3 and 4, delta and theta, like whatever. Whatever you want to call that, the non-REM sleep, that's when all your hormones are being made and rebalanced and measured and rebalanced. And so I was like, well, maybe I can get their hormones up with that. Maybe if their hormones feel better, maybe if their anabolic hormones go up, they'll feel better and they'll perform better and blah, blah, blah. And so I started heading down that way. But before, like, I think to the question we started with, I started thinking initially, I was thinking, well, maybe this is adrenal fatigue or something. So I was giving, giving them supplements. I was giving them Myers cocktails. I got in trouble for that because apparently giving vitamin IVs is beyond the scope of an MD, so I wasn't allowed to do that. I wasn't allowed to prescribe supplements. And I was like, well, I'm not prescribing them. I'm just telling them to go buy them. So it's a recommendation, but whatever. Got in trouble for that. And I was trying to use like adaptogens. So anyway, I finally, hit upon this sleep thing. And then when I knew enough about sleep, and then I read the research about what Ambien does to sleep and what alcohol does to sleep. And most of these guys were, having a few drinks every night and taking, usually overdosing on Ambien. Just the mentality of a SEAL, if one's good, two's better, three's probably great. So, they're taking way more than they should. They're usually having two cocktails with this. And, it turns out that, Ambien and any of the Z drugs, they destroy about 80% of REM sleep and about 20% of deep sleep. Alcohol destroys about 80% of deep sleep and 20% of REM sleep. So when I sent these guys to get their sleep studies, every single one of them came back 99% stage 2 sleep. So, according to a sleep study, they weren't getting any deep sleep or any REM sleep. So how they were surviving, I don't even know. But then I said, well, hey, let's get them off of Ambien and see what happens, and so that's what I did. And I gave them a little bit of daytime support, stuff, but all over the counter supplement things that they could do to kind of, inhibit aromatization of testosterone. And, so I had them like on DHEA supplements and then zinc to prevent, aromatization, pregnenolone to kind of give a cortisol pathway, and just, very basic stuff. And once they all got off of sleep drugs, which 100% of them did, and of course, when I had to get them off of sleep, I had to come up with a supplement stack to get them off of the sleep drugs, because I couldn't just say, can't just, like, they're taking Ambien because they can't sleep. So I can't just say, quit taking Ambien. So I came up with the stack, and, they helped me. They're very helpful because they're great patients, and they would come in and report to me every day. And we kind of figured out the right dosage of the right supplements. And, we got all of them, all of them got off of, the sleep drugs, and that in the combination with the daytime support stuff, they were going from the lowest 10 percentile of the normal testosterone range to the top 10%. I had a few guys go super physiologic for reasons I don't understand. I guess they were just outliers, not hugely super physiologic, but maybe 100 points out. That led to me, beating the sleep drum and trying to convince the leadership that sleep was a problem and that it was affecting their performance. And then, of course, I learned more and more over the years and realized, well, yeah, that can be affecting their mood and their emotionality and their cognition and their memory and their problem solving skills. And short-term memory, working memory, all of that stuff. And yeah, like yourself, I got my privileges suspended and investigated many times. I was told point blank to quit doing it, to quit practicing outside of my scope, and to just do sick call medicine. And I just nodded politely and said, yes, sir, and went and did what I was going to do. So, it's the only thing that made sense to me. I mean, if you given the option of satisfying the leadership or taking care of the guys that I'm in charge of taking care of, my brothers, the community that saved my life, that's a no-brainer for me. So I just said, well, I'm going to keep doing it. And if they, I didn't think they'd throw me in jail, but I thought they might figure out a way to throw me out of the military. But they didn't, other than, just sort of making to where I wasn't going to advance anymore. But I wouldn't have needed to stay in, but and then I just figured after all that hoorah, it would have, I could do a lot more for the guys outside than I could inside. And so I got out at the end of that term, or at the end of that payback period from going to military's medical school. And I just got out and started my own practice, and started seeing these guys on the side. And ironically, a few years later, SOCOM hires me to come in and lecture all of their healthcare providers about all the stuff that I was doing.
Wow.
And so, that's the Reader's Digest version of that 5 years of my life.
So what are some of the lab improvements that you saw with your patients back then, just by getting them off the Ambien, changing their sleep, and giving some, nutraceuticals and supplements?
Yeah, I tell you, everything normalized. Like, I can't think of anything. Now I wouldn't say everything optimized, but everything normalized. Because the piece of the puzzle that I didn't figure out until probably 2 years before I got out was the traumatic brain injury. Right? They're so they've all, and I can put myself in this category. Like, we've all received thousands of blast concussions. Right? So it's different. It's a different type of concussion. It causes a shear force. So basically, you can just picture a blast wave going through the brain, or going through the skull and through the brain. Like any blast, it's air compression, right? So everything that's a different density moves at a different rate. And so when that happens, everything shears. So the dura shears off the vessels, which shears off the white matter, which shears from the gray matter, which shears from the vesicular linings, and and so at every interface, you can see beta amyloid plaques now. We've seen all this in autopsies and all this now. So the TBI was a component because, traumatic brain injury not only causes inflammation to the brain and dysfunction of, what we think of as cognitive issues, but your brain is the regulator of all your hormones, right? It's really, it's the conductor of the whole show, right? So it's affecting everything. And so, I saw drastic improvements in everybody. I just didn't probably get to optimal with everyone. But higher total testosterone, higher free testosterone. I was, at that point in my career, I think I was having a really hard time figuring out how to lower sex hormone binding globulin. That doesn't correct automatically. That's something that takes time. But lowering their estradiol, and they had the estradiol levels of 30-year-old women almost. They had which raises sex hormone binding globulin, which reduces the free percentage of testosterone. Their IGF-1s would be 100, 110, and they're 32 years old. They it should be closer to 300. Their inflammation, inflammatory markers, oxidative markers, those came crashing down. Those would reduce 80-90%. The insulin sensitivity, like their fasting insulin, would drop by probably threefold. So they like I said, they weren't diabetic, but they were kind of heading up towards that number, like where you're starting to get concerned about insulin sensitivity. And I was, bringing them all back down to what you would expect from a young athletic person, something in the 2 to 5 range, 2 to 4 range. Their HbA1cs were coming down from 5.8 to 4.8, which fit for them, for the diets they were eating and the type of performance they were doing. So, everything really aligned. They were all magnesium deficient. They were all vitamin D3 deficient. So, we did that. I think that's, some separate supplementation, but we did that as well. And I had some, like the CEO of one of the SEAL teams was my patient. I had a lot of the leadership because they were the older guys. They'd been struggling with it longer. And by older, I mean, they were 40 or older. Right. But I had 42, 43-year-old, commanders and captains that were not only, they weren't just PRing for their recent elder years. They're PRing for their life. Like they were the fastest 3-mile run they've ever done in their life, the fastest, the highest squat, the power cleans, what CrossFit times, whatever it was they were into. They were getting, after a year of treatment or so, they were getting the best performance they'd ever had in their lives. And then, of course, one of the fastest markers you see, or one of the things that comes out so obvious, which we validated on the rehab side, is that we cut rehab time down by, cut it in half roughly. At least 30 or 40% faster, but the vast majority of rehab time was cut in half.
Well, that's amazing. I mean, it seems like you were making amazing leaps forward, and this is how medicine seems to be. This is what I've noticed is science in general, is they don't like the new thing until it's been around long enough. Then you don't want to be the last one on, and that's why they probably hired you to come back and teach what you had already been doing.
Right. Well, and now it's, now I think it's, a lot of it's caught on. In fact, I remember I just so happened on a flight to be sitting next to an MD PhD professor who she was at a big school, one of the Ivy League institutions, or at least one of the elite upper blue chip ones, and she taught medical ethics. And I told her kind of about some of the trouble that I'd been in. And the one thing that she harped on was, one thing that she really focused on after all I told her, the thing that stood out to her was that I was giving guys a Remedex to lower their estradiol levels, lower their sex hormone binding globulin, to increase their free percentage of testosterone, right? And she said, you really don't want to be the first doctor giving any medication for any cause, for a novel cause, or a novel, using a medication in a novel fashion. And I was like, well, somebody has to be the first one or it never happens, right? And she's like, well, I'm just telling you from like a medical legal standpoint, you're really putting yourself at risk with that one. And I was like, all right. And now that's common knowledge. Like, everybody, like strip mall doctors who do, weekend hormone courses and, whatever, open up little low T clinics or whatever they call them, those guys are doing it. Like, everybody knows it now. Same thing with sleep. It's like, when and I'm not exaggerating, and it literally happened to me where I got laughed out of the office of the leadership when I was telling them that, lack of sleep was lowering our guys' testosterone and growth hormone levels. And they just thought that was the most ridiculous thing they'd ever heard of in their life, and that I needed to go back to medical school. And I was like, all right, well, and then of course, it caught on, and now, now the average person who listens to a few health and wellness podcasts knows all that stuff. And the benefit that I did have, there were doctors out there in the world who knew this stuff, and because I was a doctor for the West Coast SEALs, and they had a pretty big media presence and sort of a quasi celebrity status. I could call up people, and after I could read someone's book or hear them lecture, or watch their TED talk or something, and I could just call them and say, "Hey, I'm Kirk Parsley. I'm the doctor for the West Coast SEAL teams. I have found what you said really interesting, intriguing. I was wondering if I could consult with you with my clients, or maybe come train with you or whatever." And every single person that I contacted, every single one of them were falling over themselves to be helpful. They all so I got to learn from some really top tier people really early, and I got to learn a lot, and so it kind of launched my knowledge level of something that probably would have taken me 10 years. I learned in a couple of years.
And I think that's one thing that's really important to understand for the listener, the viewer, is that you don't have to go to a specific accredited course to learn good information. You can learn it from podcasts. You can learn it from hearing it from a podcast, and then go studying with that guy that did that lecture and learning straight from the source. And you can learn so much faster than having, these.
And in fact, that's.
Go ahead.
Yeah, I was going to say, in fact, that's the best way to do it, because when you look at things like, what they started with, they started with CAM, complementary and alternative medicine, and then there were alternative medicine pathways, and then there was integrative, and then there was functional and integrative. But you look at any of these institutions that are teaching functional and integrative medicine, they're teaching it in the same didactic way that we learned medical school, and they're teaching protocols, and they're teaching, they're just doing the same damn thing that the medical establishment is doing, but instead of enriching pharmaceuticals, they're enriching half a dozen doctors that are writing the curriculum. And that's not the right way either, because everything changes all of the time, and you need to say, hey, within my patient population, what I keep seeing, what's really bothering me that I don't know how to fix is this, and I'm going to go learn everything I need to know about that, and to where I can work with that, and then I'm going to do that with something else. I'm going to do that with something else. I'm going to do that with something else. And you have to, granted, you have to have your life set up for that. And if you're working within the big medicine machine, that's not an option for you, right? I mean, because whether you're working in a hospital or running your own practice, I mean, you're you're using 100% of your energy to do what you're responsible to do. And then, God forbid you're naive enough to have a family or something like that, or want to have a hobby, there's no time. Like you just simply can't do that. People bash doctors a lot, and some of it's well deserved. Don't get me wrong, but people bash doctors a lot for not keeping up on the research. I'm like, do you know how much research is coming out? I mean, do you understand that? Like if you did nothing but read all day. If you got up in the morning and you read studies for 12 hours a day, 365 days a year, you would get through about 2 or 3% of what's published every year. So, that's not a solution either. You can't just read generally, right? You have to really just go down the rabbit hole, and you have to have the skills to, I don't really think I was taught that well in medical school. I think those are skills I learned later, and by and large, I'll give a lot of credit to Peter Attia, because I became friends with him, probably just about a year or two after getting out of the Navy, and and he and I worked together on a lot of stuff, and he really taught me how to evaluate research a lot faster, so that I can just throw away silly stuff. And dig in what's important. But the system just isn't the system just isn't well set up for, what we actually need doctors to do. It's not realistic for them to keep up with it. And these continuing medical education courses, again, that and at some level or another, and it'd take an hour to defend the statement. But this is something I've thought through and researched through and talked to a lot of really smart people about. The medical education, whether it's continuing medical education or just medical school itself or nurse practitioner school, whatever. I mean, like Western healthcare, that information by and large is from pharma, right? I mean, that research is funded by pharma at the end of the day, and they're hiring people that are looking into the things they want them to look into, and frankly have an incentive structure to come up with a conclusion what the pharmaceutical industry wants them to come up with, and I'm not accusing people of malevolent or malicious behavior. I'm just saying that it's human nature to gravitate towards what's rewarding to you, and I think there's a lot of that going on, and so the only way to do it is to educate yourself. And fortunately, because of my background and when I started doing all of this, it was early in the game, and there weren't that many health podcasts out there, and there weren't that many health influencers out there. And I became friends with a lot of them and got on podcast early and got on a lot of stages early and all that stuff. And with that advent of all that, it's allowed me to do private consulting. And my private consulting, I can spend 15 hours figuring out one lab value on one of my clients that I don't understand if I want to, right? And I can spend 2 hours interviewing my clients on their initial intakes, and so it's my life is set up to be able to do that. But I'm still, my knowledge is still limited by what I see clinically, right? I mean, there's all sorts of stuff that I don't see clinically that I know nothing about, that the general practitioner probably knows a lot more than I do about.
Have you been treating patients that are vaxxed injured?
Yes. Quite a few. Unfortunately, my mother's one of them. My mother had a stroke after the vaccine. Fortunately, it wasn't a huge stroke. It was moderate in size, but I knew what to do to treat her, and we literally, left the same day she got discharged from the hospital. We drove straight to a hyperbarics facility, and we started her hyperbarics. And I've started her on sort of all the neurological enhancing peptides, and we've done all of the treatments very well, and she has nearly she doesn't have any sequelae that you or I would pick up on, but she has nearly no leftover residual symptoms from it. But yeah, I've seen a lot. I've seen a lot of it, and we're going to see a lot more. I heard the one podcast I'll always listen to is Anybody Smart talking about the vaccine, because I don't think people appreciate how complex that issue is. I mean, I for one thing, I mean, let's be honest, like the human is the most complex thing we know of, right? and we are that, and we have the ability to study ourselves, but we're the most complex thing we can imagine. And the body doesn't have systems, right? Like we break it into systems as a way to learn it, but everything's working simultaneously, and everything impacts everything else. So everything is a part of everything else. So there are no systems. But if you want to call it systems, then it's one complex system overlaid by another, overlaid by another, overlaid by another, overlaid by another, living within this environment, which is complex system after complex system after complex system. And there's no way that any one person can really know anything, and collectively we probably understand about 1%, 2% of human biology and physiology, but we act like we know a lot more because we use big words and publish papers on them, whatever. But there, one thing I just heard Peter McCullough say, and I'd heard it earlier on Brett Weinstein's podcast, The Dark Horse. He was talking about how the mRNA isn't even actually RNA, because instead of where uridine would be, they put a uracil there to make it more stable, but we don't have an enzyme to break that down, so the mRNA doesn't break down. And any mRNA that stays in the cell long enough forms a plasmid, and the plasmid can be incorporated into the genome. And so, that's the whole purpose of a plasmid. And the plasmid can get in the nucleus and actually become part of your DNA. And if that happens, well, then you have a sequence of your DNA that's going, if expressed, epigenetically expressed, then it's going to produce spike protein for the rest of your life. And the spike protein itself is toxic. So why they chose that, one can only guess, but seems like a very stupid idea. And so, that spike protein is toxic. And if you're producing it forever, even if it's intermittently forever, who knows what it's going to do? I mean, it's definitely going to attach to vascular endothelium. It's going to attach to all solid organs. So you're going to have liver problems and kidney problems and heart problems and immune problems because it's in your spleen, and intravascular problems anywhere where it's binding to intravascularly to, say, like a capillary. Well, that's going to block a red blood cell, and red blood cells obviously go single file through capillaries. So if there's a spike protein bound in there, that's not getting through there. So now you're cutting off blood supply to what? Anything, right? And well, if it happens in the brain, we call it a stroke. And if it happens in the heart, then it's a heart attack. But what about when it's happening in your bones, your muscles, your liver, your spleen, or your kidneys, or your lungs, or, whatever? I mean, it's still causing damage. And so I don't think we're anywhere close to understanding the magnitude of what's likely to come from this vaccine. And we do know that the more vaccines you get, the more likely this scenario is. I've heard some postulates or speculations that what really saved a lot of people was the instability of the vaccine. And so when they're like having vaccines done at a stadium or at a drive-through or something, those vaccines are probably getting so warm that they degraded. And if they degraded, then you didn't get nearly the same mRNA load, or maybe you got no mRNA load. But with every successive vaccine booster you get, like, you're more likely to get the full dose, right? As people get better at preserving it and all that stuff. So I don't even want to know where it's going to go, but I guess, we're going to see. I'll see what I see in my lifetime, but they're vaccinating children now who will be alive after I'm dead, hopefully. And who knows? Can it be passed on genetically if it gets embedded into your DNA? Probably. I mean, I don't know.
Yeah, and one thing you said about the degradation of this mRNA over time, which I think you're right, absolutely right, that it probably saved a lot of people from damaging substances being injected to them. But even siRNA, or small interfering RNA, is a thing in the body. And what it's designed to do is when a gene is expressed and it gets sent out of the nucleus and little bits get clipped off, those little bits that get clipped off go back into the nucleus and say, quit expressing this gene because we have enough of it available. And that was never brought up in public. No one ever said, oh yeah, your RNA can, epigenetically affect your genes and how they're expressed.
Right. And as that, well, for anyone who doesn't know, the epigenetics that, I mean, that's far more important than the genetics, right? Like every cell in your body has the same genetics, but they're not all the same type of cell, right? The reason a liver cell is different than a kidney cell is different than a heart cell is because of epigenetic expression, right? All the same DNA's in there. It's just like what's being expressed in that cell. So you start changing that, you start changing yourself at a cellular level. And that's not likely to manifest itself until it's really like a really big deal, right? You've completely changed the function of a tissue, perhaps.
And there's so many people that are not reporting their injuries, and I'm not exactly sure why. Yesterday I spoke to a retired Marine general, and he was unwilling to come on my podcast at this time. I pray that at some point he'll share his story. But he left because of his injury. And it's, he was a warrior, and he's not happy with what happened to him. He was very upset with what happened to him. But I'm hoping that he'll come on here to help encourage those that refuse to get it, to give them strength. And I hope that he comes on to also encourage those that have been injured to speak out about their injuries so that we get justice here on this earth.
Yeah. I mean, unfortunately, I'd say I probably get a call, at least one call a week, probably closer to 2 calls a week, from some military member, and this is all word of mouth, of course. I don't advertise myself, but it's just through some sort of mutual associate between us. I get calls weekly from young guys who have these strange, obscure findings that nobody can solve, but it's preventing them from finishing whatever training they're in. So unfortunately, I get a lot from pilots. And I've had it as bad as one pilot I'm working with. I want to say he's like 25-ish, completely young, healthy guy, and he was four flights away from being qualified in fighter jets, which is obviously like the most competitive thing. So they gave him like a medical respite, and as long as it was less than 60 days, he didn't have to go through a med board. And then when I told him what he needed to do to improve his symptoms, he said, "Well, I don't think my flight docs are going to sign off on that." And I said, I think you're probably right. So you can you handle that however you want to. And he went and talked to his flight docs, and they said no, that he couldn't do that. Ironically, the thing they were the most concerned about was him being in hyperbarics, and hyperbarics is definitely one of the most powerful treatments. And I'm like, okay, well, he kind of does hyperbarics every day. Right?
Hypobarics.
Hypo to back down to the ground is, so he's doing hypo and then coming back down to ground, which is hyper. So he's recompressing from where he was, from his hypo state down to ground state, whatever. So ironically, that was the thing they were the most concerned about. But he didn't, he said he was going to stick with their advice. And then, I don't know, maybe 2 or 3 weeks later, he was hospitalized. They thought maybe he had a stroke, and he didn't have a stroke. He didn't have a stroke by any clinical findings, but he can't get himself out of this milieu, and so I just said, I wish you luck, and I wish you well. But it's not, it's not my place to tell this guy he needs to work with, violate his own integrity and work around the system. And honestly, I don't know that I would do that if I were him either. I would just say, hey, I'm going to do this maybe. And like, if you kick me out, you kick me out. But my long-term health is more important than my wings, I think is how I would approach it. But, but he's young. And so he probably doesn't think that his long-term health is going to be a problem. This is just a little glitch and he wants to get his wings. And so he's doing whatever he can. But I would imagine at this point, he's probably in front of a med board and he's probably not going to be able to, do it. And, and I bring that one up just because um, that one was just really kind of heartbreaking for me, because he's so young and such a high achiever. And when we first started working together, we had a real shot. When he first called me, I had a real shot of kind of getting rid of all of those symptoms. Now, how long those symptoms, stay away, I don't know the answer to that yet. But I have seen just night and day difference in people in as little as 2 weeks of treatment. And I don't treat anybody just for 2 weeks, but I have people I had another guy he's a stunt man and an actor and a former UFC fighter and just an all around amazing dude. And he's about my age. And he had a stroke from the vaccine as well. And, I treated him and we got through 100% of his symptoms. And, he probably hasn't done any treatment now for 6 or 8 months or something, and he's still fine. But I don't know, like maybe, 3, 4, 5, 6, 8 months from now, some of the symptoms are going to start coming back. I don't know at this point how long the treatment takes. But as we were talking about earlier, if it gets incorporated into the DNA and it gets re-expressed, one can only assume it's going to be either the same result or, whatever, some kind of other result, depends on where it gets re-expressed in. There's a lot of evidence that it consolidates, anything that has a ton of capillaries in it or capillary-like passages. So think of the kidney and the testicles and ovaries and the liver and the spleen and those types of solid organs that have a ton of blood flow and tons of passages because they're working on one red blood cell at a time, essentially, right? All of those are likely targets, right? And then the brain just doesn't take any kind of insult well. It takes a very small insult to have a really big neurological deficit that could last the rest of your life. So, are the people who had strokes, is that their only risk, or do we have to 2 years from now are we going to see something much more common in people? I don't know. My guess would be that depending on it, if the plasma does incorporate into your DNA, does it incorporate into an area of DNA that's highly expressed in that cell, right? So, and then that would determine, right? Because if your epigenetics are such that, well, that area incorporated into a liver cell, say, but the region where it incorporated doesn't ever get expressed for liver cells, well, then you're probably not going to have liver problems. But I don't know the answer to that, right? I don't know if there's a routine place where it's being embedded or if it's random or something. I don't know enough about genetics to know that, but I do know that this is not even close to being done. We're nowhere near the finish line on this. This is the beginning.
Yeah, and with this being the beginning, and if people are looking for good doctors that have a good head on their shoulders, are you accepting patients? And is there a place where people can get a hold of you if you are accepting patients?
I'm not accepting patients. I do one-off consults for for military folks or like anyone in the SEAL, like any special forces guys, of course, I see. Um, I I do have private clients, but that's uh, I don't. That's not a like a that's not like a disease model. It's a health and wellness model. So it's really it's a lifestyle modification course that is a year. It's a 1 year annual fee. It's prohibitively expensive for most people, because I take very few clients so that I can spend I can spend as much time as I need. Um, but if people, want to go to my website and uh, ask for questions, um, or ask for help, if you can give me the region of, if you can tell me where you live, or, the areas that you'd be available to seek treatment. I have a decent network within America, a few outside the country, but primarily within America. And I'm happy to try to line you with people who do the types of things that I do. And I am working with several people. We're trying to sort of figure out a way to do some sort of registry that people could go to and just like look up physicians who think in this way. And there is that frontline doctors thing, the FLCCC or whatever. They focus they focus on a lot on this vaccine. Um, I don't know exactly what their physicians are doing. I haven't followed up on that aspect of them. I use their protocols to treat COVID, but I haven't looked into their sort of long COVID or vaccine injury um, protocols yet. But that would be another place. I mean, there's I think 50,000 doctors involved in that, so you can probably find somebody close to you who has some good ideas. But I can tell you that the most efficacious things that I've seen is combination of peptides, and peptides are limited to clinical research. So when I'm using with my patients, I'm technically doing research. But peptides, hyperbarics, and then full spectrum saunas, some combination of that is what I've seen the best effects with. And then targeting, of course, whatever your specific problem is. But one of my good friends, a PhD in Tampa, owns a hyperbarics facility. He had a vaccine injured woman who couldn't talk. Hadn't been able to say a word since she had the vaccine, and it had been, I don't know, 4-6 months or something. And after 10 hyperbaric treatments, she was 100% better. She could, in fact, they wanted her to quit talking. That was the big joke. They're like, Jesus, once we got her talking, I was like, man, maybe we should have only given you 8 treatments, but yeah, I think she stayed in treatment for a full 8-week treatment. But again, it's another problem with Western, with the American medical system. One of, like, my residency in the Navy was in hyperbarics, right? So that's part of the dive medicine residency for the military. And we have 13 approved uses for hyperbarics. So if it's not one of those 13 uses, you have to pay cash. But if a hyperbarics facility does insurance-based work, then they can't do cash work. So anything associated with the hospital is doing insurance work. So you have to have one of these 13 things. And if you don't fit in there, you can't use that. So I have a ton of clients who are nowhere near a hyperbaric chamber. And if they have the means and the time, they move temporarily. They go stay somewhere for 2 months and do some treatment. And I I'm kind of working with some investors and stuff. I'm trying to create some mobile facilities, put a chamber in an air conditioned trailer and because a lot of these chambers you can learn to use yourself, as long as you're a fairly healthy person, you can get in there and operate it from the inside and treat yourself. But if there anybody listening to your podcast is interested in a business model, hyperbaric facilities are going to be, they haven't let out a ton of the research yet. It hasn't hit mainstream media, but I'm well steeped in that community, and unquestionably, it's going to eventually come out that this is the best, in combination with it. But honestly, if you could only do one thing, I would say do hyperbarics. But hopefully there'll be facilities that are doing adjuncts to that hyperbarics. But I think that's probably going to be the number one thing that people are going to be using for these long COVID and COVID vaccines. And not that you can distinguish those two anymore, right? Because so many people got vaccinated and then got COVID. Okay, so what is it? Is it the vaccine, or was it damage from the COVID, or is it damage from the vaccine? Like we're never going to know. But it does seem to be, the benefit of hyperbarics is that you can get oxygen to places where you don't have blood supply, right? Because the only way to carry oxygen in your bloodstream is by being bound to the hemoglobin and red blood cells. Unless you do 100% oxygen and you take it down to deeper than 1 atmosphere, you go down to 2 atmospheres, and then you can crush air bubbles, like oxygen bubbles, into the plasma, and that can just diffuse out anywhere, and it can go all over your body, and over the course of time, it saturates all of your tissue with oxygen. And then that, of course, that's of course what your mitochondria need. It's part of oxidative phosphorylation. Mitochondria need that to produce their energy, which is your cell's energy, which is, your cell's ability to do their work and repair themselves. And so I think hyperbarics is just going to be an enormous opportunity. And I know a guy here in Austin who owns the biggest facility that produces hyperbaric chambers. He owns the biggest one in the country, and they're already having a hard time keeping up with demand. So the word's slowly getting out, but that's going to be a really big treatment. And I would encourage anybody who's listening to this who has problems that they suspect are from the vaccine or from long COVID, whatever that is, to seek that out. And those soft chambers that you see at the strip malls, there's no evidence that those work. They don't go deep enough, and they're not 100% oxygen. So you're not comparing apples to apples there.
Dr. Parsley, thank you so much. I want to be respectful of your time. I know you've got some deadlines coming up. That is great information, and perhaps sometime in the future you can come back on. This was very good, and I hope people are able to, if there's any special operators out there, they can reach out to you, and if not, get help from you, find where to get that help. Thank you so much.
Yep. Yeah, you're welcome. Thanks for giving me the opportunity to blabber.
Thank you, sir. God bless. Just a reminder for everyone out there, duty uniform of the day, the full armor of God. Let's all make courage more contagious than fear. I recently got a new affiliate. It's Harvest Right Freeze Dryer. I've been using them since 2016. It's a great way to preserve food for long periods of time, up to 25 years if stored properly. Please take a look at it. Use the link below. Thank you.